Somewhere in the research on dementia, buried in data from studies that tracked thousands of older adults over years, a finding emerged that has changed how a growing number of researchers think about cognitive aging. The finding was not about genes. It was not about diet or supplements or the crossword puzzles and cognitive training programs that have been recommended for decades. It was not even about the quantity of sleep, which has dominated the public conversation about brain health for years. It was about rhythm, specifically the regularity of daily patterns, when people woke and when they slept, whether those patterns held consistent from one day to the next or whether they drifted and varied. And what researchers found when they quantified the stability of those patterns in adults over 70 and then followed them forward in time was that the disruption of daily rhythm was among the strongest behavioral predictors of dementia risk they could identify. Not a minor predictor, not a correlation easily explained by other factors. Among the strongest predictors in the data, if you are over 70 and your daily rhythms have become less structured, your sleep timing more variable, your meals less consistent, your activity less anchored to reliable hours, the research now suggests your brain is paying a price that no supplement and no neurologist's appointment is currently addressing. In this video, I'm going to show you how a disrupted body clock increases dementia risk through 4 specific biological pathways. Not a vague association, a traceable mechanism that researchers have now mapped from clock disruption to the actual proteins and processes that define Alzheimer's disease. And I'm going to tell you what the research shows about rebuilding the clock, because it can be rebuilt, and the rebuilding is more targeted than most people expect. At around the 9-minute mark, I need to tell you about a medical procedure, the most commonly performed surgery in the United States, that a growing body of research now associates with improved circadian stability and reduced cognitive decline risk. Almost no one performing this surgery discusses this finding with their patients. Almost no one receiving it knows. By the time I give you the details, the connection will be obvious. But right now it would seem entirely unexpected. I have spent more than 3 decades in geriatric medicine, and the research connecting circadian disruption to dementia pathology is among the most important literature I have read in recent years. Not because it introduces an entirely new disease mechanism, because it reveals that a mechanism we already understand, the gradual accumulation of Alzheimer's-associated proteins in the brain, is significantly accelerated by something that most people over 70 are experiencing without knowing it is relevant. Let me give you a way to hold the science before I give you the science. Your brain is not a static organ that degrades at a fixed rate. It is a dynamic system with built-in maintenance processes, protective mechanisms that run on schedule, calibrated to specific windows of time each night, governed by a biological clock that coordinates them. Think of those processes as a tide, not a metaphor for something gentle or optional. An actual tidal system, arriving at specific hours, clearing what the day has deposited, running the maintenance that keeps the brain's structures intact. The glymphatic system runs its deepest clearing during early night slow-wave sleep. Melatonin's neuroprotective and anti-inflammatory activity peaks in the middle of the night. The brain's inflammatory suppression mechanisms are calibrated to be at maximum suppression during sleep. Each of these tides is set by the body clock. Each runs at a specific window, and each, when the clock loses its precision, begins to arrive at the wrong time, at reduced amplitude, or not at all. The brain accumulates what the tides were designed to clear, and over years, that accumulation is not silent. Let me be specific about what happens when the clock loses its rhythm, because there are 4 pathways, and each one is distinct. The first is one you may recognize from other contexts, the glymphatic system's amyloid clearance. Amyloid beta, the protein that accumulates in Alzheimer's disease, is cleared from the brain primarily during deep slow-wave sleep in the early part of the night. In adults with irregular sleep-wake patterns, this deep sleep occurs at inconsistent times or is fragmented. The clearing window shifts. The tide comes in at 3 in the morning instead of midnight, partially, inefficiently. Amyloid accumulates faster. This pathway is well established in the research literature. The second pathway is less widely discussed. Tau. Tau is the protein that forms neurofibrillary tangles, the second defining hallmark of Alzheimer's disease, distinct from amyloid plaques. Animal research has consistently shown that circadian disruption specifically accelerates tau phosphorylation. the chemical modification that makes tau protein begin forming tangles, and that this acceleration is separate from and additive to the amyloid pathway. Human research using PET imaging has found associations between sleep-wake irregularity and tau burden in older adults. Two separate Alzheimer's pathologies, both accelerated by the same disrupted clock. The third pathway is melatonin's neuroprotective function, which is distinct from its sleep signaling role and is almost never discussed in that context. Melatonin is a direct antioxidant in brain tissue. It scavenges the reactive oxygen species, the oxidative damage products that neurons generate through their normal metabolic activity and that accumulate when the brain's protective systems are working below capacity. In adults over 70, melatonin production is often 70 to 90% reduced compared to levels in young adulthood. This is not simply a sleep problem. It is a loss of a primary neuroprotective molecule from the brain's antioxidant defense system. The neurons are exposed to oxidative damage that melatonin used to buffer. The fourth pathway is the most recently characterized, the NLRP3 inflammasome. The NLRP3 inflammasome is a key driver of the neuroinflammatory process associated with Alzheimer's disease progression, and it has a circadian regulation pattern. Under normal circumstances, it is suppressed during sleep, its inflammatory activity controlled by the body clock's nighttime inhibitory signals. In adults with disrupted circadian rhythms, the clock's suppressive signal weakens. The NLRP3 inflammasome loses its circadian regulation. Its inflammatory activity runs without the restraint that the body clock was supposed to provide. The neuroinflammation that drives Alzheimer's pathology advances more rapidly. 4 pathways, all of them traceable to the same disrupted clock. Now I want to tell you about a patient I worked with, no name, because what this person experienced represents a pattern in the geriatric literature that has a clear enough shape to be recognized. They were 73 years old, cognitively intact by every measure, when their spouse of 46 years died. Within 18 months, their family brought them for cognitive evaluation. Measurable changes had appeared, not dramatic, but real, and faster than what the previous trajectory would have predicted. The standard workup was performed. Standard findings for age were documented. What no one examined was the clock. The spouse who had died had been, without either of them knowing the word for it, a constellation of zeitgebers, the scientific term for external signals that anchor and synchronize the body clock. Breakfast at 7 every morning together, the evening meal at 6, consistent to within 15 minutes for decades, a bedtime routine at 10, shared, a morning rhythm that began when the other person woke. These anchors, invisible while they existed, obvious in their absence, had been holding the body clock in precise calibration for decades. After the death, meals became irregular. Sleep timing drifted by hours across the week. The morning light that had previously arrived because both of them had a reason to begin the day together now arrived whenever it arrived, if at all. Within 6 months, the body clock had lost every external anchor it had relied on. The rhythms became variable, fragmented, inconsistent, exactly the pattern the prospective studies identify as associated with accelerated cognitive decline. The cognitive changes followed the circadian collapse with a delay of perhaps 12 months. Enough of a gap that no one connected the two. Enough of a gap that it looked like coincidence, or age, or the inevitable progression that bereavement is sometimes assumed to accelerate for emotional reasons. It was not emotional. It was biological. The tides stopped running on schedule, and the brain accumulated what the tides were designed to clear. When circadian structure was deliberately rebuilt, not through medication but through anchored daily rhythms, consistent meal times, morning light exposure, and structured social engagement at predictable hours 3 times each week, the rate of cognitive change slowed. Over the following year, measurably. This is not an anecdote that proves a point. It is a case that illustrates a mechanism the research has repeatedly documented. Now, the 9-minute mark, the surgery, cataracts, the most common eye condition in adults over 70, affecting more than half of people by age 75. Cataracts develop when the lens of the eye becomes clouded, reducing visual acuity. Cataract surgery, the most frequently performed surgical procedure in the United States, removes the clouded lens and replaces it with a clear, artificial one, restoring vision. What almost no ophthalmologist discusses in the consultation before or after surgery, what cataracts block and what surgery restores, is not only vision. The circadian light signal, the specific blue wavelength light that travels through the eye's lens to the specialized retinal cells that communicate directly with the suprachiasmatic nucleus, is attenuated by cataracts. A 75-year-old eye with cataracts transmits significantly less blue spectrum light to the SCN than a clear one. The master clock receives a weakened signal. Its precision degrades. The rhythms drift. Research published in peer-reviewed literature has found that older adults who underwent cataract surgery showed improvements in sleep quality, circadian rhythm stability, and circadian amplitude after surgery. One landmark study found that the cognitive decline rate in the years following cataract surgery was lower than in matched controls who had not yet undergone the procedure. The surgery most commonly motivated by the desire to read, to drive, to see faces clearly, is also by restoring the light signal to the SCN, a circadian intervention, perhaps one of the most powerful available to a person over 70. If you or someone you care about has cataracts and has been delaying surgery, waiting until it becomes more necessary, putting it off because vision has not yet declined to the point of significant functional impairment, the circadian and cognitive protection argument is one that belongs in that conversation. Bring it there. Here is what I want you to hold before we move to the protocol. The body clock has not been destroyed by age. It has been progressively deprived of the information it needs to run with precision. The light signals have weakened, partly biological, partly because cataracts block them, partly because older adults spend less time outdoors where sufficient light exists. The social timing cues have reduced. Retirement removes schedule. Bereavement removes shared rhythms. Reduced activity removes movement-based signals. The biological oscillation of the SCN has declined, but not ceased. What the clock needs is not a medication. It needs information. Reliable, consistent, correctly timed information arriving through the channels that set it. Restore those inputs and the clock responds, not immediately, over weeks, but measurably, and with consequences that reach the 4 pathways I have described. 3 things. Each one restores a category of timing information the clock depends on. The first is the social zeitgeber structure. Deliberately build at minimum 3 consistent social timing anchors into each week. Events that occur at the same time, with the same people or the same purpose, week after week. A walk with a neighbor at 8 in the morning on Tuesday and Thursday. A call with family at the same hour every Sunday. A group activity, exercise class, community meal, religious service at a consistent time. These social timing cues are among the most powerful non-light zeitgebers the research has identified. For adults over 70 who have experienced retirement, bereavement, or reduced social structure, deliberately rebuilding these anchors is a circadian act with consequences that extend well beyond social well-being. The second is the cataract conversation. If you have been told you have cataracts, or if someone in your life over 70 has them, bring this finding to the next relevant medical conversation. Research has associated cataract surgery with improved circadian stability and with reduced cognitive decline rates in the period following surgery. Ask your ophthalmologist or primary care physician about the timing of surgery. The conventional threshold is when vision impairment becomes significant. The circadian and cognitive protection argument suggests that threshold deserves to be reconsidered. The third is the rhythm variance audit. For the next 7 days, record 3 times each day. When you got out of bed, when you had your first meal, and when you turned out the light. At the end of the week, calculate how much each of those times varied. If your wake time ranges by more than 90 minutes across the week, rising at 6:30 some days and 8:30 on others, your clock is receiving inconsistent anchor signals. Reducing that variance to within 30 minutes is one of the most consistently supported circadian stabilization strategies in the literature. It requires no equipment, no medication, and no dramatic lifestyle change. It requires deciding that consistency matters. Let me bring you back to where we began. The finding buried in the research data. Not genes, not diet, not supplements. Rhythm. The regularity of daily patterns. The stability of when you wake, when you eat, when you rest, when you move. is among the most predictive behavioral factors for cognitive aging that researchers have been able to identify, and it is almost entirely absent from the standard conversations about dementia prevention. You now know the 4 pathways through which clock disruption reaches Alzheimer's pathology. You now know what cataracts do to the circadian signal and what surgery can restore. You now know what it means to be a zeitgeber and what it means to lose the ones you did not know you had. The tide can be restored. The windows can be reclaimed. The clock responds to information, and you have more control over that information than any conversation about dementia prevention has likely told you. If someone you know over 70 has experienced significant life disruption, a loss, a retirement, a health change that restructured their daily life, please share this video with them. The clock does not collapse from age alone. It collapses when the inputs that maintain it disappear. And the most important thing anyone in that situation can know is that rebuilding those inputs is possible, and that it matters more than almost anything else on the list of things medicine recommends. Before next week's video, I want you to do one thing. Think back over the last 7 days. What time did you get out of bed each morning? Not what time you intended to. What time you actually did. Let the range form in your mind. The earliest morning and the latest, the difference between them. That number, the variance in your wake time across the week, is what researchers call a measure of social jet lag, the misalignment between your biological clock and your actual daily schedule. And next week I am going to share what the studies found when they tracked that number in adults over 70 across 5 years. The relationship between wake time variance and dementia risk was specific enough and strong enough that it belongs in every conversation about cognitive prevention for this age group. Write down your number. Come back next week. One important note before you go. Everything in this video is for educational purposes only and does not replace the advice of your personal physician. Decisions about cataract surgery should be made in consultation with your ophthalmologist based on your individual visual and health situation. The research discussed here is an additional consideration, not a directive. If you have concerns about your cognitive health or your sleep patterns, please bring them to your doctor. The questions this video has given you are questions your physician is the right person to help you pursue.